Microneedling. Immediately after your microneedling procedure, your esthetician will apply a moisturizer repair cream topically. No sunscreen for 4 hours. Do not take any anti-inflammatory medications such as ibuprofen, Motrin, or Advil. These agents will interfere with the natural inflammatory process that is critical and responsible for your skin rejuvenation. Avoid suntanning and prolonged exposure to direct sunlight. When exposed to sun, always use sunscreen SPF 30 or above. Before bed this evening, cleanse the skin with a gentle cleanser and pat dry. Apply treatment mask for 15 minutes. Do not rinse your face after removing the mask. Moisturize with a gentle moisturizer. Redness or sensitivity might be present. Use Tylenol only as needed for any soreness. Avoid strenuous exercise or sweating for 24 hours due to open pores. Treat skin gently by washing with a gentle cleanser, cool water, using hands only, and patting dry no earlier than 4 hours following treatment. May use cool compresses for discomfort, burning, redness, or swelling. Avoid sun exposure for 3 days, and if possible, 10 days. Apply a minimum of SPF 30 every 2 hours. May use mineral makeup after 24 hours. Restart regular skincare regimen in 48 hours and Retin A in 72 hours. Follow-up and repeat treatments in 4 weeks is recommended. For best results, a series of 3 to 5 treatments is recommended. What to expect after your microneedling session. Day 1. On the next day, you may clean your face as usual and apply makeup, lotions, and other topical products as usual. Stay away from exfoliants or glycolic acids that are present in cleaners, as these can make your skin very dry after the procedure. Be sure to use an approved sunscreen with an SPF 30 or greater. Days 2 to 7. Within 2 days following your medical microneedling procedure, you will notice skin dryness and flaking. This is due to an increased turnover of skin cells. During this period, you may apply your regular skin moisturizer. Follow the instructions given to you by your esthetician. You may have a little microbruising under your eye area that may be present for 3 or 4 days. This can easily be covered with makeup. Days later, your skin will start shedding. These are skin layers that would regularly shed a week later, but the microneedling brings the skin to the surface sooner. During this temporary process, your skin will shed and be dry. You may use your regular skincare products once your skin is not irritated. Days 7+. A week after the medical microneedling procedure, most patients notice that their skin is smoother and more radiant. Continue with sun protection every day and reapply every 2 hours if outdoors. Contact us. Please contact us with any questions or concerns. 704-295-4878.